and good evening. Welcome to Anupali. It's good to be back with you on this edition of the program, and I thank you so much for joining me. As always, it has been a very busy period for us in government as we go about the business of managing the affairs of the state during a very difficult economic period. As you heard in my Independence Day address, the impact of COVID-19 pandemic continues to be felt across various sectors. However, we are making prudent management decisions and bringing our combined experience and skill to bear to ensure that the priority needs of our people are met. In particular, over the past weeks, we have seen the distribution of over 3,000 devices to students of various schools to facilitate access to their virtual classrooms. These are the priority areas I speak of: the continued education of our children, payments of salaries and wages on time to maintain livelihoods, and the ongoing work to save lives and protect the health of our people. The investments we are making in healthcare to address the recent spike in COVID-19 cases are significant. But we remain steadfast in this because we recognize that to achieve an economic turnaround, we first need to reduce the numbers of COVID-19 cases in Dominica. We are going through this in a dedicated system of care administered by a group of committed healthcare professionals at the COVID-19 care complex in Portsmouth, and the provision of life-saving vaccines to every one of our citizens. On today's program, I have invited the director of the Pan American Health Organization, Dr. Etienne, to speak with us about this ongoing health crisis. Dr. Etienne, as we all know, is a distinguished daughter of the soil who rose to the highest ranks of healthcare administration in the world. She is a former director of primary health care in Dominica, and we are proud of her achievements at the global level. And as Prime Minister of this country, I can tell you, I am exceptionally proud of the achievement of our daughter of the soil. And when I am part of summits of heads of government, heads of state, and I listen to the commendations bestowed upon Dr. Etienne, I simply sit and in awe and in a deep sense of contentment and pride. Dr. Etienne, welcome. My understanding is that you are here in Dominica on vacation. And I'm hoping that you have had the opportunity to go to the hot springs, not only in the Roosevelt Valley, but in Soufriere, at the back of the Catholic Church, the presbytery. There's a hot seawater bath you can get there, because I know it has been a very stressful period for you over the last 2 years. So welcome again. It's your second time on Anupali, and we're so happy that you have taken time off your vacation to speak to the Dominican public on Anupali. Dr. Etienne, please.
Thank you, Honorable Prime Minister, and thank you for inviting me to be part of your program again, and the opportunity also to speak and share with my fellow Dominicans. It's always a joy to be home. I can tell you, I feel nostalgic as the plane is coming closer. It's a certain nostalgia that grips me. And I really needed this holiday. I needed to disconnect. It has been a really very trying and stressful period, leading the COVID fight in the Americas. And yes, I've been to a few places. I went to the Waterwaven spa there, and up the Indian River was at dusk was another experience, and on the beach in Mero, etc. But unfortunately, I hurt my back, and so I was laid up for a week of my vacation. I really should ask for another week of vacation to replace that. But you know, Dominica is really one of the gems of the world. I see, not just the Caribbean, but of the world, and it is very relaxing, very friendly people. And I would recommend anyone who feels stressed, please come to Dominica.
Excellent. And of course, I want on behalf of all Dominicans to thank you, and of course for the entire CARICOM region, for your exceptional leadership and the guidance that you provided to us. You provided to us here in Dominica. Power has been exceptional, I must say, and I am fortunate to have you on WhatsApp, and I could have communicated with you over the last couple of years, telling you how do you deal with the situation and what's your advice, what is Power's view on this, are we doing the right things, should we change this, and you were always very responsive, and you would also pass on your staff to us to follow up on the technical issues. So we're very grateful, and of course just on Friday, you presented to us a wide range of goodies that are so critical in our continued fight with this COVID-19, with buses and hardware and software, 30,000 PCR tests, kits. This is a lot of money, and we're very, very grateful for this, and they will all go into the usual good use to help protect our citizens and provide our citizens with both preventive care and also treatment.
But let me tell you, Honorable Prime Minister, this is not just Dominica. We do that for all of our member states. Of course, we always have a soft spot for Dominica. And because I'm Dominican, they need to make sure that they also take care of your needs. But we work with all of the Caribbean countries, South America, Latin America. I mean, countries like Brazil, we're helping even to give them also some of the supplies that they need.
Excellent, and every help we get, we welcome it. Now, Dr. Etienne, the last time you appeared on this program, we spoke of the threat of COVID-19 to the collective health of people in the Caribbean and Latin America. What is your assessment of the situation currently?
So, I continue to be concerned. I think it is a mixed situation. Latin America, or the Americas, was the epicenter of the pandemic for many, many months. Recently, we have been overtaken by some countries, some other countries and regions, but this region bore the brunt of the epidemic for a long time. And we were also the region that was receiving less vaccines, Latin America and the Caribbean, than other regions per se, even while we were having many cases. And so it has affected our health situation tremendously. We had something like 95 million cases reported, and I stress reported because there were many other millions that have not been reported, and some 2.3 million deaths having occurred in the region. But outside of just COVID, we have seen deaths from other causes because resources had to be withdrawn from other services to respond to COVID-19. And particularly in the early days of the pandemic, for the first 8 months, so to speak, what we saw was a total reduction in access to primary care services primarily. So our immunization coverage dropped. Our coverage for antenatal care, for chronic diseases, and mental health, because the pandemic also exacerbated the mental health problem. And what made it worse is that now they did not have access to services to deal with their mental health issues. Also, care for persons with cancers. Much of that care had been postponed because the ICU beds and the hospital beds were all taken up with severe COVID cases, because we had really severe cases, particularly those that are not vaccinated, when we didn't have vaccines, and hospitals were totally overwhelmed. So they were not available, the beds, to deal with the cardiac conditions, with the heart attacks, to deal with the comas, to deal with cancer treatment. So there is an accumulative effect on the health and well-being of peoples. And I'm just talking now only of health. And I'm sure we will come to the economic and social aspects of the pandemic. Nutrition as well was affected for many reasons. First of all, no money to buy food, particularly for the vast majority of those who live in poverty, did not have access to food. And there was growing food insecurity in Latin America and the Caribbean. And so our nutrition status also was affected.
Yeah. Now, the COVID-19 is not merely a health concern. It has far-reaching social and economic implications. How are you seeing this manifested in the Caribbean and Latin America? And what are your concerns for the long-term impact of this pandemic on developing states?
That is a good question, because what we've seen is that economies have been really devastated, particularly in the Caribbean that depended on tourism. If you would remember that in the initial almost a year, borders were closed, and there was no tourism. So very early in the pandemic, we said that the pandemic had effects on the economy and in the social sectors, and that neither of those could recover until we dealt with the pandemic. And this is the same situation that has occurred. So what we've seen is a decrease in GDP that is projected to be about 6.8% for this year. We haven't seen increased poverty. So poverty up to extreme poverty, 33% of Latin America and the Caribbean is in extreme poverty. I think it has exacerbated the inequity that is so much part of the Latin American situation, and I dare say increasingly in the Caribbean as well. So it has made that inequity worse. There is a certain increase in informal labor, because many people lost jobs during this time, could not fend for themselves, so they entered the informal labor market, which of itself exposed them to infection with COVID. So it is really, and our unemployment rate we lost almost 9% of the employment rate in Latin America and the Caribbean. Of course, this is worse in women. Women, the poor, the indigenous populations in Latin America suffered the most and continue to suffer the most. And the projections are from the Economic Commission on Latin America and the Caribbean is that it's going to take years for us to get back to the economic levels that we had. So it is very serious.
I agree. Now, how concerned are you about the ability of small states, though, to provide adequate care and protection for citizens in light of this, yes. These challenges that you have enumerated?
And for SIDS, this is very troubling. Certainly for the Caribbean, without tourism, without being able to carry out normal economic activity because of the COVID restrictions. How are we going to recover our economies? And with the climate change issues that we have to deal with on a regular basis, that is just only going to make matters much worse. So SIDS, and particularly SIDS in the Caribbean, we face a very, very difficult situation for years. And I think it is important that Dominicans recognize that no government has an unending source of income. And if we want our economy and our social way of life to improve and to get back to where we were, we are going to have to make some changes in our way of life. We are going to have to accept what are some of the measures that will reduce our COVID rates. If not, we are going to remain a stagnant economy for a long time.
Yeah, I want to continue on this point. I mean, what is your best advice to our citizens on getting back to the sense of normalcy and reversing the numbers that we currently have?
Well, we have, as PAHO, as working with ECLAC and all of our other development partners, we have come to the realization that the trajectory of this pandemic, as it happens, we are beginning to see that this pandemic may well go into an endemic situation. Because if people got vaccinated and followed public health measures, we could stop the transmission of the virus and end the pandemic. But this is not what we are seeing. And even in countries that have arrived at a 70% coverage of the vaccine, once they relax on the public health measures, we see a resurgence in the number of cases again. So we are going to troughs and waves. The only way out of this is to vaccinate all of our people. Now, people talk about herd immunity, but we don't know for this virus what coverage equals herd immunity. It differs for different viruses. For measles, you have to make sure that 95% of your children are immunized against measles. If not, over a number of time, you will get a measles outbreak. So people were saying at first 70%, but we don't necessarily know it is 70%. Because Chile has 70% coverage, and they are now seeing a rise in infections. And the same thing in Uruguay. So you need to get vaccinated and encourage everyone you know to get vaccinated once they're eligible for vaccines. And we need to strictly adhere to public health measures. That's how we can get back to Carnival and to National Day and Creole Festival, etc. That's how we can get back to this.
Now, our healthcare workers have been on task since the outbreak of the COVID-19 in early 2020. Based on PAHO's work directly with the health authorities here in Dominica, what is your assessment of Dominica's response to this healthcare crisis?
But honestly, I was so proud of Dominica and the way Dominica had dealt initially with COVID-19, the measures that were put in place, and the way that we used our healthcare workers, particularly in the primary healthcare, to contain the initial infections that we have in terms of case identification, contact tracing, quarantining, follow-up, etc. This was a perfect storybook of what should happen in primary health care and with the public health measures and the communications, etc. And the way that we use the multi-sectoral, the police, the ambulance drivers, the community leaders, everyone got involved. But I think that it's a different story now. I know that the healthcare workers in the primary healthcare and also those that are caring for the COVID patients are doing a marvelous job. We've been able to keep the death rate, the case fatality rate down, significantly. But I know it is at a great cost to the government. And I am not sure how long we can continue to do it like what we are doing right now. And I do know that we've made some recommendations. A team has made recommendations as to how we can do this. I know that we've done some training, and that should improve care even more. But my hat's off to all of the healthcare workers. They deserve praise, as much praise, and thanks for the sacrifices that they've made and the work that they've done. So I think generally we were really perfect. We are seeing now that government is fulfilling its responsibility, but we need everyone to take up that responsibility. Every individual. You know, last night I was in a supermarket, and somebody, hi, how are you? I saw her, and then afterwards she came around and she said, Doc, can I talk to you? So I say, certainly. She said, you know, I'm not vaccinated. So I say, why not? She showed me some things on her feet, and she's so scared. And I said, but why are you scared? This is not a contraindication to getting vaccinated. Nothing will happen to you. You should go and get vaccine. I said, I've had my how many doses? Just in 5 minutes, she said, okay, Doc, I will go and get my vaccine tomorrow. So, but that's the responsibility of every individual. Not to spread the negative comments and advice, but to encourage people to get vaccinated. Because if we don't, we are going to remain in this situation for as long as possible. And that's the projection for the next 9 months to a year. So.
Sure, thank you. I know everybody's listening and watching, and everybody's taking notes. And you know, we have seen indisputable evidence that vaccines work the world over, Dominica, the Caribbean included. What is PAHO's conclusion about the efficacy of vaccines based on the data available to you at PAHO?
Okay. So there are a number of vaccines. There were up to 200, 300 vaccine candidates. And there are a number of vaccines that are on the market. Now, we like to distinguish between the vaccines that have received the WHO emergency use listing. And those are, I think, about 6. Pfizer, Moderna, AstraZeneca, Johnson & Johnson, Sinovac and Sinopharm, and recently Bharat Biotech has also received emergency use listing. So the senior advisory group of experts on immunization of WHO are saying all of these vaccines are safe and they are efficacious. After months of using them, of course, some of them have a higher efficacy rate than others. But what is clear, those vaccines are meant to reduce severe illness and to prevent hospitalizations. 94 to 99% of the people who are dying in hospital or admitted with severe illness are not vaccinated. And some of them are only partially vaccinated. So we know that those vaccines work. And we tell people the best vaccine for you is the one that is available to you. And then afterwards. So we know, as I said, that the efficacy wanes over time. And so the SAGE has put out some recommendations. Of course, you know, the US has recommendations for boosters. And they are different than the recommendations by the WHO SAGE group. So the WHO SAGE group is saying that for all people who are severely immunocompromised, moderately compromised, they should take a booster dose. For Sinovac and Sinopharm, if you're more than 60 years, you should take a booster after 4 months.
So what would be your advisor to us here in Dominica with regards to the booster shots? Because I have received WhatsApp messages from senior citizens who are eager to get the booster shots.
I tell you what was one of the reservations of the SAGE group is that it is almost immoral to be giving people booster doses when there are millions of people in countries who have not received a single dose. And so that is the consideration, and it is a sovereign decision for every country. If you're offering vaccines to people and they're not taking up those vaccines, then if it's Sinovac or Sinopharm they have, offer it to particularly those over 60 and the very elderly, so they can have a booster dose. And if you've had AstraZeneca and you are immunocompromised severely or so, then, you know, instead of the vaccines expiring, offer it to people who are immunocompromised, as I said.
Okay. Thank you very much.
But that's just my advice. It's your decision, sir.
Yeah, we know. I think I'm hoping that very soon we will take a decision on this, because I know there are several people who have messaged me and who are waiting for this policy decision by the government, and I'm hoping that very soon we will get this advice. Now many of our activities, as you know, have been curtailed due to COVID-19. Our children are not able to access face-to-face learning. Social activities are on hold, and people are talking about carnival. I'm hearing a lot of talk about carnival. Funerals, church services, weddings are all restricted in terms of numbers. How do you explain to people the direct correlation between getting back to these normal activities and their vaccination status?
It's a no-brainer, really. Yeah. People who are vaccinated can be infected, and they can pass on the infection. So I think we need to know that. But those who are not vaccinated have a higher chance of becoming infected and passing on that infection. And so the public health measures call for social distancing. So there needs to be apart. It calls also for wearing of masks. It calls for frequent hygiene and good respiratory practices, the hand washing or hand sanitizing. And also, if you are feeling ill, you should not go out of your home and expose other people. And you should seek a test if you're not feeling ill as early as possible. But those are simple public health measures. But from the 2 weeks I've been here, I've been seeing all sorts of measures that don't add up to good public health measures. People wear masks badly, so the masks are under their nose or under their chin, so that's no protection from masks. I see people congregating without masks at all. I see various types of hand washing. Hand washing is supposed to be, you're supposed to wash. What is the song you should be singing? Happy birthday to you. But for a length of time, with enough soap and so, or if you're using gel as well, it has to be a significant amount in between your fingers, at the back of your hands, or, thoroughly. I don't see that. I go to supermarkets. Up to last night, he's taking my temperature, but he's pointing to my abdomen, fully clothed.
I see.
So until people become very serious about adhering to the public health measures, they have to learn to accept that there is a possibility. And it is the government's responsibility to protect the people in terms of the public health. And so I dare say that your hands are tied by the people, the people themselves.
So you're essentially saying that to get back to these normal activities, rest with the people.
Yes.
So people have to
get vaccinated, and so it's both. Because we have seen that in countries that have significant 70% or more vaccination coverage, when they relax on the public health measures, they get another spike. So we are saying both things until we are able to eliminate transmission.
Yeah. Now, Dr. Etienne, based on public pronouncements, that this government has not taken a decision in respect to mandatory vaccination. What is your position on mandatory vaccination? And is this something you think this government should consider?
All right.
It's a tough question to ask. Publicly.
No, because I will not. I will not give you my personal opinion. I will tell you what Power's position is.
Sure.
So our position is that this is a sovereign decision. We know that the making vaccines mandatory have been fraught with civil unrest, with demonstrations, etc. And what we do know, however, that where mandatory vaccination has been deployed, like among healthcare workers in some countries, that the coverage has risen to 94, 95%. from 40-something, 50-something to 94, 95%. Now, this is a group that should be vaccinated. They themselves are exposed, but they also expose patients to the spread of the infection. So we know that countries that have done that, we know that there are some businesses that have imposed either you get vaccinated. Some say you can't work here if you're not vaccinated. Others says else every week you have to bring me a negative COVID test. Now that's one of my concerns too, because I find when I look at the figures in Dominica that instead of going and get vaccinated, they're going for tests. You see how many thousands of tests people are going to take. Really, testing is not going to prevent you from getting COVID. What you should be doing is getting vaccinated. So at some stage you have to consider letting people pay for those tests. I mean, if your business place says that you must provide tests, then you should go and get the test commercially. Because the government has provided you with vaccines, they provided you with the information. If you want to go and expose yourself, then pay for it. But yeah, let's stop here.
You know, I've gotten a question from Facebook. You know, there are quite a few vaccine skeptics. You know, so someone is saying, look, if the vaccinated can still get COVID and spread it, how can we ever get back to normal?
So remember I said that measles. Remember I said that you need 95% coverage with measles vaccines to prevent an outbreak. Now, if there are enough people vaccinated, the virus has greater difficulty spreading from one person to another, because the transmissibility to a vaccinated person is much less than to an unvaccinated person. So if there are sufficient numbers that are vaccinated, the virus will stop having susceptible people, and so it will stop the transmission. Another thing that we have to consider is, as long as transmission is occurring, then we can have the emergence of variants. Now, people think it's just the alpha, beta, gamma. No, we have variants occurring all the time. Once there is a high transmission rate, variants occur. Not all of them, the mutations occur. Not all of them rise to the level of a variant of concern. So you may have from that a variant of interest and a variant of concern, based also on the spread, the ease of transmissibility, and the severity of the disease. And so Dominica and the Caribbean had Delta variant, and that was responsible for the massive increase that we've seen. In Latin America, Delta was not the main variant of concern. It was more Gamma. But Delta had higher transmissibility and caused worse disease. So the vaccinations helped. We had smallpox, and smallpox was really a terrible disease that killed. And the way we stopped smallpox is by vaccination. When sufficient numbers of people were vaccinated, there were no more susceptibles, so the virus died. And if people will recall, if they're old enough, you couldn't travel without a smallpox vaccine certificate.
Yeah. Now, our children are currently engaged in virtual learning at all levels, and parents and guardians are pulling their hair out because it is a challenge in terms of those who have to go to work and who have nobody to care for their children, and there are many parents who are unable to manage this virtual learning that's going on. However, we are hoping to return to face-to-face education at the start of the new term in January of 2022. How do we safely return to the classroom? And what are the protocols that must be adhered to by students, by parents, teachers, and principals? Okay,
good question. Because You know, 167 million children lost a year of education because of COVID. And as you well say, I mean, the poor, where there was not the digital literacy and no availability of devices, these children suffered even more. So we have almost a generation that has lost an entire year of education. PAHO has guidelines, PAHO and WHO, we have guidelines for the reopening of schools. I will just name the general ones that you can. There must be social distancing in the classroom to begin with. Classrooms have to be well ventilated and with ingress and egress for air. Everyone has to be masked, and there must be stations for hand washing, increased stations for hand washing and hand cleansing. But then you also need to look at recess time. Recess time can't be the same for everybody, so you have to stagger recess time, and you have to manage recess time as well, because not all of the children can be in a group playing. They would not be able to do this. You may have to stagger class times as well, so you don't have 200, 300 children in a coming into school at the same time, because there's no way they will social distance. You may have to start certain classes at different times and let out classes at different times. So school cannot close at 3:30 and then everybody goes out. There's no social distancing here. And I would say that all your teachers would have to be vaccinated. I would think so, at a minimum, that teachers should be vaccinated, because children are coming into contact with them. But it is more difficult for children to understand social distancing and follow social distancing. So the classroom also has to be an environment where they are repeatedly told and educated about this and made to practice it. And there must be a lot of vigilance also. If a child is ill, they must not come to school. And if the teacher observes a child ill, they must ensure that the child is brought to the health clinic and tested, etc.
Yeah.
But I would advise you to also look at our guidelines on that.
Sure. Now, somebody's asking on Facebook, what is PAHO's position on people with medical condition that can't take the vaccine? You spoke of this lady you met at the supermarket. And then the second part of the question is, what is considered a genuine medical condition? Because we hear this a lot. People say, look, I have a medical condition, and my doctor tell me I shouldn't take the vaccine, and so forth. What is PAHO's view on this?
The first thing is that your healthcare workers themselves have to be educated. Doctors as well as nurses need to understand the disease and understand vaccines and understand what are the contraindications for those vaccines and what are the side effects for vaccines and who is contraindicated. For things that people complain about, they have cancer, well, except that you are on immunosuppressive therapy, you should get vaccinated. If you have diabetes, you should get vaccinated. Hypertension, you should get vaccinated. If you had DVTs, because somebody told me they had deep vein thrombosis, you should get vaccinated. This is law. If you have liver disease, you should get, once it's controlled, you should get vaccinated. People on renal dialysis, you should get vaccinated. So there are really very few conditions where you should not get vaccinated. So putting this forward and coming with, I have a medical condition that I can't get vaccinated, that's just stalling and vaccine hesitancy. But what I think is that people who have questions must be able to call and get factual information. I hate to say that, but not every nurse and every doctor understands and knows those things. They should, because they should be reading, but it's not so. There was a patient, a Dominican patient on dialysis, and she said, "Nurse, should I get my vaccine?" And the nurse said, "Well, if it was me, I wouldn't take it." You know? Yeah. This is a very patient who should take it. They need to be protected. So.
Yeah. Thank you very much. Well, we've heard it from Dr. Carissa Etienne on who should take the vaccines, and now we are now fully educated, more educated now. Now, we have now made vaccines available to children 12 to 17, as you know. Would you advise more Dominican parents to allow the children to get vaccinated?
Yes. Yeah. The SAGE group in WHO, they've looked at Pfizer, and they have said that children 12 to 17, before it was 18 to adult, but that now children 12 to 17 can receive the Pfizer vaccines. But you know that in the US, both the Drug Regulatory Authority there and CDC have approved vaccination, Pfizer vaccination from 5 to 12, 12 to 17, and 18 and older. And that has gone through pretty rigorous examination, and they can. So yes, both WHO and the US CDC have decided that children 12 to 17, it is safe for them to receive the vaccine. And so I really want to encourage parents, because the other thing that they've been finding is that, particularly with the Delta variant, young children were getting severe COVID and had to be hospitalized, and some of them dying. And there is no reason why that will not happen in Dominica if we continue to expose our kids. And if we want our children to go back to school, we should create the environment where they are more protected and so don't have to catch COVID, or that COVID does not spread in the classroom. They bring their kids for immunizations. They take their kids to clinic from birth. They start getting immunized. At 3 months, at 6 weeks, 3 months, all of these vaccines, and we've never had this, and I actually don't know where it's coming from.
Now, are you recommending to the government also that we vaccinate children below 12, between 12
no,
5 and...
WHO has not yet.
WHO has not yet done.
Yeah, no.
Okay. Okay.
But many countries are.
Yeah, it's like that. Yeah.
No, but I can only give you what's the official.
No, we respect this. Now, we have had to suspend, as we mentioned earlier, our major activities, entertainment activities. And I was listening to the radio, Kyrie FM this afternoon with Peter Pross and
Oprah.
And Oprah.
I'm a listener too.
Yeah, they're making a case on behalf of their listenership for these activities to come back, a little carnival at the stadium, they call it. So large entertainment activities and socializing in large groups are not allowed. As we look ahead to Carnival, there have been recommendations that we consider hosting events in a vaccination bubble. So only vaccinated people should be allowed in. Would you support such an idea? And if so, how do we do this as safely as possible?
This has to be considered pretty seriously. Once people congregate, there is always an opportunity for infection. If it's a carnival situation, people are going to be drinking. They are not going to be wearing their masks while they fit, so that increases the opportunity. As I said, even though you're vaccinated, you can be infected and you can transmit that infection as well. Now, how are you going to ensure that everybody that hands you a certificate that that person is vaccinated? Do they have to bring an ID card so you can verify? Because I can take my brother's, or I will have to take my sister's card and bring, and you think that I'm vaccinated when I'm not. And one of the serious considerations as well is if you have this mass congregation and then you begin another wave of cases, you spark a wave of cases, what is the capacity of your health system to deal with a large number of cases? And for many of the, even the bigger countries, their health systems and services have been overwhelmed by COVID cases.
Course,
much less for a small island with the capacity that we have. Where are you going to treat with them? Who is going to take care of them? How are you going to manage? Where are you going to get the resources and investments to do this? These are serious questions that need to be considered by any government, and that is our recommendation to them. You have to weigh the relaxing of public health measures with, are your health systems and services ready to deal with a large number of cases, and when you have brought people to congregation. And I dare say, we say the same things for campaigning, election campaigns, because that too draws a large number of people, and we have guidelines for that as well.
That's why we've been very careful ourselves as a party. We did by-election in Granby. We've avoided the usual Labour Party style campaign.
Yeah, because we've seen massive increase in cases after election campaigns.
So we're very careful with this. Now, some of the advice we have heard during the pandemic is of the need to lead healthy lifestyles and to boost the immune system to be able to better fight the virus. What is your advice on this matter?
I think people at all times should lead the healthy lifestyles. I think even for the morbidity and mortality that we see from chronic diseases, both for prevention and management, people should try to live healthy lifestyles. I don't necessarily think that you get such a boosted immunity that you could withstand a severe bout of COVID infection. But at all times, we should try to live healthy lives. We should always do that. And if you do it during COVID, guess what? We will better control chronic diseases, we will prevent chronic diseases. But just remember, there are some people who exercise every day, eat right, do everything right, and have died from COVID. So it's no guarantee.
Now, what other specific advice would you give to citizens to guide their behavior and approaches to this virus?
Well, first of all, take the virus seriously, because it is serious. It is, even now with the Delta variant, it is causing serious illness and deaths that have increased, for increasing death rate for those who are unvaccinated. So please take it seriously. We have seen in Dominica a number of deaths among the elderly, and that is growing. And really, these are people who have contributed to the development of Dominica. It is all of our responsibility to take care of them. So the first thing is to take it seriously. The next thing is observe your public health measures. Do not let your guard down. Really, for the one night of CO, you are going to put your life in danger. I mean, it really doesn't make sense. And I do know and appreciate that people are getting fed up with the public health measures. But they can form small bubbles. If 10 of your friends are all vaccinated and you all can observe public health measures, you can come together in the open and have a get together, you know, where you do not have excessive drinking and all of that and expose further. But then you need to get vaccinated. You need to get vaccinated, and you need to follow the public health measures. There is no other way out of it. This is the way out of the pandemic. I have said that, and we have repeated that every week on my weekly briefing. We say the same thing.
Now, how will PAHO continue to support health systems in the region to maintain best practice and manage effectively? And I'm not only speaking with regards to COVID. There are a number of other health imperatives with CNCDs and others that we have to confront at the same time fighting this deadly virus.
Thanks for that question. And you know, health systems, that's my passion. So I'm best known in WHO, PAHO, for health systems expertise, and I do allocate a lot of resources to the organization and development of health services. We have sounded the call for universal health coverage and universal health care, that every man, woman, and child, be you rich or poor where you live, should have access to health care when you need it without becoming impoverished. And that we think this is a government's responsibility to provide this. We've also worked with and working with countries to impress upon them that any reorganization of your health system should take into consideration that your first level of care, primary health care, is your most important level of care. And that you should invest 30% of your public resources for health at the first level of care. And that you should remove at least 30% of those barriers at the first level of care by 2030. And so we have a compact on that. We also say that you need to develop, but before I move from primary health care, it can't just be primary health care. Those investments have to make sure that the primary health care level can solve the problems. They are equipped, you have trained professionals for quality of care that can solve the problems at that level. Mm-hmm. We also say that we need to form a network of delivery services. So the primary healthcare level clinics, etc., should be well connected with the hospital level, and they should be working in a network. And for that we need to improve a lot of the facilities, diagnostic, curative, etc., both at primary healthcare and at the tertiary or secondary care level. We are very clear about financing of the health system, that governments need to spend at least 6% of their GDP on the health system, and that health and the health system should not be seen as expenditure. It is an investment. It is an investment in the economy and the development of the country. We also say that the health systems must be people-centered. So we need to bring the people back into the healthcare decisions, not just personal and individual healthcare decisions, but healthcare decisions about the system. And we stress good governance. Good governance is essential at all levels of the health. Without good governance, then you will never have a well-functioning health system. So those are just a few of the things that we stress, and we give governments the support to get those things to happen. We do the capacity building, the training, etc.
No, Dr. Etienne, is there light at the tunnel?
Yes, there's always light. Yes, there's always light at the end of it. COVID, as I said before, it is challenging, but we can overcome it if we want to, and if all individuals come together with a collective vision and commitment to get it done. So there is, and when enough people have died, the others will realize that they need to take the vaccine or die too. Sure, you know. Sure. So, but I hope we never get to that point. And I think that there is light at the end of the tunnel. Generally for health, I think governments are beginning more and more to recognize that they need to invest more in health. And thank God for COVID, because COVID opened the eyes of many governments. When presidents and heads of state had to come and to lead this response, they realized the lack of investments in health systems made them more vulnerable to COVID. And of course, with that is the social determinants of health, that attention needs to be paid to the social determinants of health. I can speak for the whole night, so I'll stop.
I know. Now, Dr. Etienne, you have certainly distinguished yourself with a record of achievement in primary health care. That's why I knew you many years, my aunt and so forth, Stella. You know, in Dominica, as you know, we're making significant strides in our primary healthcare system. You know, including the provision of modern, smart facilities, some of which Power has helped us with retrofitting and reconstructing. But how do you think we can continue to solidify the gains we have made, especially in primary health care? You know, I have a very strong inclination towards primary health care because I believe we can stop many things at that stage.
Exactly.
And of course, we're making some improvements at the secondary and tertiary level. How can we continue to solidify the gains that we're making in the health system in Dominica?
So let's deal with primary health care to begin with. Yeah. I think the investments in improving the infrastructure, that is very important, and in equipment, because you can't always have to be referred to the hospital level for a simple test. So those have to be made, those basic services have to be made available at the primary health care level, so decisions as to the care of the person can be done there. Then, fundamental to the primary health care level is community participation. We have to bring back community participation. Dominica had village health committees, district health committees, and regional health committees. We had a strong engagement of the community in both the discussion with the health team, but also in their voicing their satisfaction or dissatisfaction with their services and with the health team in a joint engagement. That has to be brought back. People must be at the center. The services are not there for the doctors and the nurses, and so that's the other thing. We need now to place the person at the very center, the person and the community, the family, at the very center of healthcare. We need to establish health teams that will undergo building, team building. You don't become a health team because I say you're a health team. We have to have good leadership in the district, and we have to have well-trained personnel there, but we have to build them into a team where they can come together and make decisions for the entire district. But that takes a lot of work. And it takes a certain level of leadership that can bring all of them together to discuss the problems of the district. And you cannot come to decisions about healthcare in the district if you do not have the statistics. So statistics are very important. You need to know how many pregnant women are in your community, how many children have been born, so you can plan how many immunizations that you have to give, and so what is the level of staffing that you need for this. You need to know how many homes, and in which homes, what are the conditions in those homes, how many diabetics in this home, how many hypertensive, how many children under 5 years. All of those are statistics that must help you in the planning. And we need frequent planning meetings, but that has to be supported by a team at the central level who can guide. We need protocols developed. So long ago, we had a protocol for immunization, a protocol for this, a protocol for that. One of the very important things, and remember that 40, 50 years ago, they used to call the district services, district health services. Those were primarily built around mother and child care. Now, when we further developed post-David and post the Alma Ata Conference in 1978, primary health care tended to be focused more on mother and child care, the immunization, the visits of the mothers, the visits of children, this and that. Of course, we did TB and we did communicable diseases and school health, but the main focus was that. I think that the challenge that we have now as well is how do we bring in some essential services and work it into the fabric of the primary health care programs, like our chronic non-communicable diseases. We need to make that the center of our the organization of our primary health care services. And almost 80% of our mortality is based on that. And if you ask any health district, the most patients they see are chronic disease patients. But that has to be managed better. and has to be managed within a primary healthcare approach. So civil society, all the different parts of society must come together, and even the community. When we did primary healthcare, you know who were the best educators, health educators? The very community members. They would put on skits. They would do, once you gave the information to them, then they packaged and imparted it to the rest of their population. And they too helped with the going door to door. But that is the focus. And I also say that in PAHO, we need to see how all of those essential health programs fit within the fabric of the primary health care. And once you do that, you will have less demand on your secondary care. Your secondary care will then have more time, and healthcare workers would then better be able to give quality care to the people there. You just won't be coming up because your pressure is so high, it's going through the roof. You know what I'm saying?
Well, thank you very much, Dr. Etienne. I know with our passion for health, we could spend the whole night speaking and still continue to speak in the morning. Your tour of duty ends early 2023. You would have served your second term. Yeah. Second term. And this is, you can only serve 2 terms at PAHO. What's next for you?
Where the Lord leads. But I'm coming home. My plans are that I will come home. And I will live like a Dominican citizen, and that I am. And but I'm sure that there will be opportunities to lend my experience in various areas. I have already been asked to be on the board of directors of a certain medical school. I have not been able to take it up because it conflicts with my responsibility now. So I'm sure I'd be asked to be on different expert panels or so. And of course, I would like to see how best I can serve my country and my countrymen as well.
You know what I'm seeing, Dr. Etienne? I'm seeing a huge billboard. Dr. Etienne for Prime Minister.
You didn't say that.
I think you would win 21 seats.
Okay, maybe.
Don't
let even let my husband hear you say that.
I'm sure he's hearing me, and he has stood in applause. And I have the words I would use, the phrase, the campaign phrase I would use for you, and I would offer myself to be a campaign manager.
Well, you see, I don't see myself as a national politician in that way.
But it has been a wonderful pleasure as always speaking to Dr. Etienne. I have had the privilege to be able to converse with you privately on a number of issues where health is concerned and the region and so forth. And so it's wonderful that we can share this with the public at large. I believe that you are always a voice of reason and a voice of guidance and an authority on health matters. And I believe that having people like you speak to us is what we need in these times where people can be guided with accurate information and professionally presented in the best interest of all our citizens. So I'm very grateful for you accepting to be here this evening during your vacation to speak to the public. And for those of us who know you, you will never let an opportunity pass by to speak to people of all walks of life on issues of their own health and their well-being. So we want to thank you for this, and we wish you all the best in your next several months of stewardship at PAHO, but we're all confident that you'll continue to lead the process of our response to this COVID-19 pandemic and on the other health issues confronting the PAHO hemisphere. And I believe that we'll all owe you a debt of gratitude for your sterling leadership and the calmness in which you have been able to manage this. And I also want to say to the public that I understand that in 2019, before this COVID-19 came about, you were able to put in place preemptive and proactive measures to deal with any pandemic if you were to be confronted with a pandemic. And lo and behold, a few months later, a pandemic is there, and I think the Lord would have spoken to you then. And so it's always important to listen to this inner voice which guides us and so forth. And somebody like you who's very, very spiritual and who've been very much involved in the charismatic renewal and in the Catholic Church, I'm sure the Lord will continue to guide you. So we wish you all the best. God's guidance to you and your family, and we thank you for the service. You are a true leader, and a lot of women out there, I know, look to you to seek to emulate your leadership and to make their contribution not only to the national sphere but also regionally and internationally. So God bless you, and of course I want to thank all your colleagues at PAHO. They have been exceptional. Ms. Wilson, who is here, and the other team members who've been here with us over the period of time, especially in the early days in preparing us for COVID-19 and training our staff. But PAHO, we have always been able to rely on PAHO in difficult times. And I want to say to the Dominican public that with the help of PAHO, after Hurricane Maria, we were able to manage the health situation to the point where, in an unprecedented manner, there were no health outbreaks. Because of the guidance and the interventions which were supported by PAHO, and we're really grateful for this. And PAHO has been holding our hands during this very difficult time. So we are very grateful to this, and thanks to all your staff. I'm sure many of them are watching their bus on Upali. Let's talk. But thank you. A wonderful evening. I want to say to us in Dominica, let us always look at the glass half full rather than half empty, and let us thank the Lord for the blessings, as small as they may be. They're difficult times, but we must be a people of faith, and we must have hope that tomorrow will be better than today. And that's how Christians and Muslims and Hindus live, that they believe that there's faith and there's a better hope. And so we cannot give up. When there are difficult times, we have to work harder, and we have to hold each other's hands even more tightly. And that's what the government is seeking to do to all the citizens in Dominica. God bless, and have a wonderful week ahead. Thank you very much.
Thank you.
Thank you. Thank you very much.
Hi guys, my name is Adam Ford from Adam Songs. Honestly, it was a bit hard to come in and decided to take the vaccine. But when I think of everyone else and I think of the entertainment industry, I just have to decide, you know what, let me just take that chance and make that decision. So I just want to encourage everyone, that for some reason they want things to get back to normalcy, for whatever reason, I think they should take that chance and make that choice also.
I think this is definitely the way so we can make it, so things can go back to normal,
I feel that getting vaccinated is something that's necessary for us to go back to normal, like how things were before, and I'm excited to be one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm going to take my COVID-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't like injections. I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important.